Peace to everybody. This is about the new study suggests fish oil derivative may benefit heart health. And if I know there are words I cannot pronounce, so please do not judge me because I know there are words you cannot pronounce. New numbers suggest that a purified fish oil derivative, a prescription drug called Vascepa, is more effective at preventing cardiovascular events than previously thought. So that you can get it by prescription, the fish oil, and it could help with the cardiovascular events and also the heart health. The drug lowered the rate of these events in high-risk patients, including strokes, heart attacks, and deaths from cardiovascular causes, by 30% overall versus placebo, according to a study published Monday in the Journal of the American College of Cardiology. So yes, so it is a high risk patients that could do it, take this stuff, including the ones that have stroke, heart attacks, and deaths from cardiovascular causes. But it's just a lot to do with the heart, but it's also up by 30% overall versus the placebo kind. This is better than previously thought because the study authors took into account not just first cardiovascular events as before, but also second, third, fourth events, and so on. Earlier results were announced by Irish drug maker Amarin Pharma in September, and then in a study released November in the New England Journal of Medicine. So this pharmacy or drug maker, he pretty much had a study on this fish oil. It could be for the second, third, fourth events, and then so on after that. By looking only at first events, we underestimate the true underlying treatment benefit offered, study author Dr. Deepak L. Bhatt said in a statement Monday. So they did a study on this and to see if it's safe to take or not. With this drug, we are not only preventing that first heart attack, but potentially the second stroke and maybe that third fatal event, said Hatt, executive director of interventional cardiovascular programs at Brigham and Women's Hospital and professor of medicine at Harvard Medical School. So they're just pretty much only preventing it for the first heart attack, but you never know when you're going to have that second, third, fourth, and so on with it. According to these latest data on cardiovascular episodes, Vascepa slashed first events by a quarter second and third events by more than 30% and later events by almost a half. The researchers estimated that by treating 1,000 patients for 5 years, they could prevent 76 coronary revascularizations, 42 heart attacks, 4 strokes, 16 hospitalizations due to unstable angina, and 12 deaths related to cardiovascular causes. So that is a lot to go through. You have 76 coronary, 42 heart attacks, and then 42 strokes, and of course 16 hospitalizations. That is really a lot to go through for all these patients and that, and of course there's 12 deaths related on top of it. The study was funded by Amarin. The drug was previously approved by the U.S. Food and Drug Administration in 2012 to lower triglycerides, a type of lipid in excess of 500 milligrams slash DL. So yeah, so it was approved by the Drug and Food Administration in 2012, and they wanted to make sure that it could lower the triglycerides of this fish oil that people are supposed to be taking as prescribed or whatever. Vascepa is a prescription drug derived from a single omega-3 fatty acid isolated from fish. Patients receive 4 grams per day, which Barrett described as the rough equivalent of eating more than 20 servings of fish a week, according to the Monday statement. However, eating that much fish would also add saturated fats and other ingredients to one's diet, the statement followed. I would not be eating that much fish during a week because if you eat too much fish during a week, you could become poisoned with mercury because that's where it's coming from. The fish has mercury in it, and if you eat too much of that, that's it. You're going to be sick or whatever. So that's why they suggest you have a single omega-3 fatty acid of fish, not having it 20 servings of fish a week. Amarin gave early wind of the drug's positive results in a September note to investors, boosting company shares from $2.99 to more than $12. At the time, experts said the initial findings were not widely expected. The science behind fish oil and cardiovascular health has been inconclusive, and many studies have not shown a benefit. So it went from the company's shares went from $2.99 to more than $12. I think that's too much of a big jump, but they had to do it, whether they like it or not. And the science behind fish oil and cardiovascular health is pretty much what they're studying on. Fish oil studies have produced ambiguous results, but this component carries significant effects, said cardiologist Dr. Russell, a Mayo professor of public health at the University of Minnesota, who was not involved in the trial. He said the latest results show certainly more clear outcomes than just taking fish oil capsules. So yeah, he wasn't even in this, not even involved in a trial, and they just decided, well, we're going to leave him out, which is wrong because I do believe he has a right to know what is going on. In September, I can't even say that word, initially reserved judgment on the drug, but now has a more positive view. So now the drug has a more positive view, but why would they say that it doesn't, but now they do have a positive view? The number of events prevented is not trivial, he said shortly after attending a presentation on the drug at a meeting of the American College of Cardiology on Monday. It gives more meaning to something that many of us have suspected for years. The triglycerides are important, and treating people that have high triglycerides is a useful thing. So yeah, people who have high triglycerides is a more useful thing for the fish oil, and that it could help. But cardiologist Dr. Rita Redberg raised additional concerns, saying in an email that a number of unanswered questions remain. For example, the most common events in the study were coronary revascularizations procedures like stents that bring blood flow back to the heart. However, she said this can be quite subjective and done at the discretion of the investigator without objective criteria. So doing the study, and if there is a lot of unanswered questions. Who knows what are those questions? We don't know, but I'm pretty sure they're there, and they're doing the best they can to try and answer every question that there is. She also expressed concerns about how closely involved Emery was in all aspects of the study, which may cast a large shadow of bias, said Redberg, a professor of medicine at the University of California, San Francisco, who was also not involved in the trial. So there was another person that was not involved in the trial. Redberg was not there. So why did they leave her out? What? So they can also hide things from her? I guess whatever they're hiding, they just don't want two people to know about it, and I think they have a right to know what's going on. It is premature to recommend it Vascepa, she said. We should stick with our strong evidence-based recommendation to eat a Mediterranean-style diet, including several servings of fish per week to reduce cardiovascular risk. Like I said, that is too much fish to have per week. I mean, if you overdo it, the mercury will make you sick. So I suggest you not eat so much fish during the week, because once a week is fine. That is fine with the fish once a week, but having it every single day of the week is a no-no, because the mercury can do something to your insides. It could also make you sick. Ipker, I don't know if I'm said that name right or not, also pointed out the prescription drug can cost in the ballpark of $300 per month, which is not inexpensive, and said it was important to recognize who was represented in the study. So this fish oil prescription, it can go to $300 per month if you have that kind of money. If you don't, then I don't know. They don't know what else to do, but $300 a month is it's not really that inexpensive, but you can make do what you can. The 8,179 patients in the study had LDL levels in the normal range, controlled by statins as well as elevated triglycerides. In addition, they either had established cardiovascular disease or they had type 2 diabetes and at least one other cardiovascular risk factor. Patients were followed for a median 4.9 years. So they were following these patients for 4.9 years. Also, they established cardiovascular disease and the type 2 diabetes. And of course, there's the LDL thing levels that you must have controlled. The new study describes the drug as well tolerated with no significant differences in rates of serious adverse events versus placebo. The researchers did find an increased risk of irregular heartbeat and bleeding that was not linked to other serious events like strokes. So this study, they said that they found irregular heartbeat and bleeding. So I'd be really careful what you do and what you take. Talk to your doctor about it if you have that problem. Additional questions remain about how the drug exactly works. Experts say it's unclear whether the drug prevents cardiovascular events by acting directly on triglycerides or whether they are a marker for some other process going on in our bodies, or perhaps some combination of the two. So they're still pretty unclear whether the drug prevents cardiovascular or by the triglycerides. So they don't know what is happening right now, but they're working on it to find out what is going on. Roughly, a quarter of Americans aged 20 and older have elevated triglycerides. According to data from the National Health and Nutrition Examination Survey, high triglycerides are associated with an increased risk of cardiovascular disease in combination with low HDL and high LDL. According to the U.S. Centers for Disease Control and Prevention, the agency says lifestyle choices, including exercises, weight loss, diet, and quitting smoking, can help lower triglycerides. So if you are smoking or whatever, you need to stop because the CDC is pretty much involved in this, and it says a lot. The lifestyle choices, you got to have like exercise, weight loss, do your diet, quitting smoking. So it's pretty much can help lower your triglycerides. Heart disease is the top cause of death in the U.S., leading to the deaths of more than 600,000 per year. So that's a pretty big number that people are dying a year. 600,000 people a year. It's too much. And it's because of the heart disease. And you really need to take care of yourself. Quit smoking. Eat in moderation, change your diet, do some exercise, or whatever else you can do to help prevent all this. What do you think about it? Tell me in the comments below. I am out.